Epidermolysis bullosa by Bailey Frank and Salome Leake. What is epidermolysis bullosa? First described in 1879, epidermolysis bullosa is a group of genetic conditions that cause the skin to be very fragile and to blister easily. EB mainly affects the stratified squamous keratinizing epithelium of the skin. EB is a rare genetic condition that makes skin so fragile that it could tear or blister at the slightest touch. Dystrophic epidermolysis bullosa. If you have this type, your skin doesn't have collagen to hold it together, or the collagen you do have doesn't work very well. Living with EB. EB patients can feel isolated. How does this happen? Mutations in the COL7A1 gene causes all three major forms of dystrophic EB. This gene is in charge of the protein production that is used to assemble type 7 collagen. Collagen gives structure and strength to connective tissues such as skin, tendons, and ligaments. According to the U.S. National Library of Medicine, type 7 collagen plays an important role in strengthening and stabilizing the skin. It is the main component of structures called anchoring fibrils. Anchoring fibrils hold the epidermis, the top layer of skin, to the dermis, the bottom layer of skin. COL7A1 mutations disrupt the production of type 7 collagen. This means anchoring fibrils are compromised, and that connection between the epidermis and dermis are weakened. The weakened structure between the two layers allow friction or other forms of contact to possibly cause a separation. This separation between the two layers leads to the formation of extensive shedding of skin and blisters. When these wounds heal, they create extensive scar tissue that can stiffen parts of the body and negatively affect mobility. The genetics. The most severe types of dystrophic EB are inherited in autosomal recessive pattern. Autosomal recessive inheritance means that both copies of the COL7A1 gene in each cell have mutations. This means that both parents are heterozygous for the gene, or each carry one copy of the mutated gene. In this case, both parents are carriers, meaning that they do not show signs and symptoms of the conditions but still carry the mutated gene. The milder form of dystrophic EB has an autosomal dominant pattern of inheritance. Autosomal dominant inheritance means that one copy of the altered gene in each cell will cause this disease. About 70% of all people with autosomal dominant dystrophic EB have inherited an altered COL7A1 gene from an affected parent. The remaining 30% of affected people have the condition as a result of a new mutation in the COL7A1 gene. These cases occur in people with no history of the disorder in their family. These two diagrams give you the visual representation of the difference between recessive inheritance and dominant inheritance pattern when it comes to EB. Associated health risks. EB patients often have associated health problems as listed by Spillman and Mayer, MDs. Patients can suffer from oral and esophageal ulcers, which results in poor nutrition and electrolyte imbalance. As healing occurs, scarring can result in fixation, including the tongue and esophageal structures, which increase the risk of aspiration. This also affects hands, elbows, knees, and feet, which decreases mobility. Other common health risks are chronic infections, hypercoagulable states, hypoalbuminemias, amyloidosis multiple melanomas, diabetes mellitus, chronic pain, dilated cardiomyopathy, and renal dysfunction. Nursing tips. Allow patients to move to and from the operating table and other surfaces. Apply hydrocortisone cream to all sites where pressure or friction is likely to occur. Secure IV and arterial catheters with gauze and sutures. Avoid tape. Lancing the blisters will prevent them from getting bigger. Large blisters can leave large painful wounds that take longer to heal. It's usually recommended to leave the skin on top of the blister to protect the lower layers of skin. If an open wound needs addressing, it's best to use one that doesn't stick to the skin and is easy to remove. Use cotton padding to protect the skin from blood pressure cuffs. Be careful because even touching the skin can be painful. Therapy and treatment. Chronic antibiotic therapy is common. Phenytoin and steroids may reduce bulia formation. There's no cure for EB, but there are treatments for it. In some cases, EP patients might need surgery. Doctors may suggest a feeding tube, so food goes right into the stomach.
without food abrasing the esophagus. Current strategies to develop effective new treatments for EB are focusing on gene and protein and cell-based therapies, although to date there have been no clinical trials in patients with EB beyond skin grafting.